on this TGF-beta. Yeah. Could it be that blocking the AT1 receptor with this existing drug could potentially slow or stop the progression of the cancer? You know, it basically takes away the production of that bad TGF-beta.
Yeah. Logical. Yeah.
Yeah. And what this could do is it could slow the progression of the cancer and potentially remove the immune suppression shield that the cancer is generating. Yeah?
Useful.
Now, moving on to the next slide. So the next question, of course, is where's the AT1 receptor coming from? Yeah? And it turns out that the AT1 receptor is actually produced by cells that are under stress. So when a cell is stressed, it produces the AT1 receptor, which then produces not just TGF-beta, but you know, a whole host of important molecules which are there to basically deal with stress. You know, this
oxidative stress.
Yeah, oxidative stress plays a part. Hypoxia, so that's hypoxia. That's basically too little oxygen in the blood. Oxidative stress is basically where you've got oxygen-free radical species. And also, you know, physical stress causes the production of AT1, and also either too little or too much blood sugar as well.
Right.
You know, it causes cells to be stressed, and they produce AT1 as a response.
Infection?
Infection causes stress. Infections cause stress.
Yeah.
Yeah. And so we'll talk about that again in a bit. But what's interesting in this diagram is it shows that the relationship of so-called bad cholesterol with the production of AT1. Yeah. Now, when bad cholesterol is oxidized, this produces oxidized LDL, which acts on certain scavenger receptors, which then triggers the AT1 receptor.
Right.
Yeah. Now you know that statins are, you know, heralded as a wonder drug. Well, statins block the production of LDL, and that's why they have their effect.
LDL being
bad cholesterol.
Yeah.
Yeah.
And then Okay.
Okay. Now, when you look at this stress response, you've got things like TNF alpha, you've got IL-6, you've got TGF-beta, you've got a whole host of, let's say, pro-inflammatory mediators which are being produced.
Yeah.
Yeah.
IL-6 being interleukin?
Interleukin 6, yeah. So when you think again, you know, big picture wise, what's actually happening in terms of cancer? Well, what's happening with cancer is as a cancer starts to grow and exert a stress in its environment, for instance, a physical stress or hypoxia or low sugars, because basically the cancer is using up all of the supply of nutrients and space and oxygen. That stress basically turns into a stress response. The AT1 receptor is increased in expression by these cells that are under stress, and it's not just the cancer cells, it's the surrounding cells as well. And what happens is when this stress turns into the AT1 receptor, the AT1 receptor is then activated, and what it does is it basically causes an inflammatory response, a stress response. Yeah. And this stress response allows the cancer to grow.
Is this slide now the a cancer cell?
Yeah, that's a cross section of. No, it's not just a cancer cell. It's a cross section of a cancer. Yeah.
Yeah.
So you can see around the cancer the growth of new blood vessels to feed the cancer, and you can see in the centre of the cell of the cancer an area of dead and dying cells, where you know the cells are under so much stress that they're actually dying. Yeah. But all of these different stresses all promote basically a stress response, which allows the cancer to grow. It brings in new blood vessels, brings in it basically remodels the surrounding tissue. It switches off the immune system. Yeah.
Right.
Because any white blood cell which approaches this area basically gets swept up in this this stress response. It's no longer looking for the cancer, it's doing something else.
No, it's been redirected.
It's being redirected, exactly, and we'll talk about that in a few more slides.
Yeah.
So since the publication of the original paper in 2004, there's been a lot of studies which basically show that the expression of the AT1 receptor is really important for the cancers. The expression of AT1 in cancer patients has been associated with the aggressiveness of the cancers. The more AT1, the more aggressive the cancers are.
Right.
And it's also been associated with decreased survival in patients as well. Yeah, in many different types of cancer. Yeah.
Oh. Next slide.
Next slide. Yeah. AT1 has been associated with all chronic inflammatory diseases. Yeah. So you remember I told you that there's this switch which makes inflammation go bad.
Yeah.
It's actually the AT1 receptor. The AT1 receptor promotes chronic inflammation in all of these diseases. Yeah, so you've got autoimmune diseases, you've got lung diseases, you've got diabetes, neurodegenerative disorders, cardiovascular disease, cancer we've mentioned, bone and skeletal diseases. Chronic inflammation is important in all of these. In fact, it's the driving force.
Yeah.
Chronic inflammation is the thing which is doing the damage, and the thing which is making it arise is the AT1 receptor.
Okay. Next one.
Okay, so the next slide is it's titled "Infections Thrive and Seem to Cause Chronic Inflammation." You mentioned, infections promote stress.
Yeah.
Well, the reason why they're doing it is they're doing it to promote this chronic inflammation, because the chronic inflammation isn't effective at fighting these infections. What it's actually doing is it's hiding them from the immune system. Mm-hmm. And Barry Marshall and Warren, who won the Nobel Prize in 2005, pointed this out in the case of Helicobacter pylori, which he was causing not just ulcers, but it was causing gastritis. That's a type of inflammation in
gastric lining.
In the gastric lining, essentially. And what it's doing is it's promoting this inflammation in order to suppress the immune system. Mm. And this opens you up to cancers and all sorts of other infections.
Yeah, obviously, yeah.
So there's some key facts that start to reveal the big picture. Yeah. So we know that complex organisms have an injury response that, as we've seen, is immune system suppressive. Mm. Yeah. Now the chronic inflammation, which essentially is resulting in essentially wounds that won't heal. Yeah. These infections are basically wounding you through this process. Yeah, they're causing wounds, and this not only does a lot of damage to you,
yes,
and can even kill you. What it is actually doing is it's suppressing the immune system.
Right.
Now, infections and cancers seem to thrive in these areas. Yeah, we've seen that.
Well, obviously, yeah.
And steroids, which are typically used to treat chronic inflammatory conditions, they also promote growth, and they cause immune suppression as well. Yeah. Mm. So doctors don't like to put you on steroids because it causes these things. It causes these side effects.
Yeah, that's well known though. That's been known for years.
Yeah, and I can explain why on the next slide.
Oh, right.
Now the AT1 receptor and the angiotensin system seem to play a key role in these chronic inflammatory diseases.
Right.
Yeah.
Yeah.
And there is a reason for that. So if we move on to the next slide, I'll gradually build up a new model of understanding disease. So in the centre of this model, we basically have what's called innate responses. This is the ability of cells to respond to threats. Yep. And these sorts of threats are injury. They are, they're also stress. But these things are driven by toll-like receptors and the ability to recognise non-self. Mm-hmm. Yeah. Now if we extend this a little, the next areas around there are wound responses, immune responses, and growth responses. Yeah. And these are adaptive responses that over time our cells have developed. These are these are processes that can take place to respond fast